What do you get when you mix a health coach and a wellness coach mixed with a lot of curiosity? You get two people who ask a lot of questions about health and wellness. Today we ask, how does massage therapy help your health?
We know touch is healing, but how does it really make a difference? So let's get started as we ask.
Wait, what?
Hi, Leah.
Hi, Kamna.
I am freezing. I need
Me
one
too.
of your hats.
I have my heater on. Don't worry.
Ugh, I just turned my heater on. It
I
was it
should have
was
put a hat
annoying.
on because I have to wash my hair. It's really gross. But anyway, that's the benefit of podcast. You can't really see it unless you go on YouTube,
Cannot.
Yes.
right?
We have a guest today I'm very excited to introduce.
Yay! I can't wait.
Her
Yeah.
her name is Lotus Ajia Wanamke, and she's a licensed massage therapist for almost 10 years now. And she's also obtained certifications in sound healing, Reiki level 3, and spiritual life coaching, with a primary focus being healing through stress management. She's the owner and founder of the Art of Sound and Sanctuary, which is a combination of expressive intuitive art, sound healing, and mindfulness exercises such as yo massage, which I have a question about. She believes that healing starts from within and with a healthy and healing mindset.
Oh.
So I cannot wait to talk to you more about this.
Immediately, I heard sound healing,
Yes.
Mhm.
like from your ears.
No, well, yes. Yes.
Like,
No. So I use a variety of instruments. So sound healing has become like this trend, but it's actually been healing through sound and vibrations and frequencies has been around for centuries. And of course, our societies are always a little behind on everything and just now catching up to natural modalities and the natural way of doing things and the body actually healing itself. So as humans, we already vibrate on a natural frequency. And you have high vibrations and low vibrations. Your low vibrations come from stress and illness and poor diets and no exercise and all of that, which also ignite depression and anxiety and mental health issues and physical issues with your well-being overall. So I had been teetering with this whole holistic lifestyle thing for years. I would have been a therapist now for almost 20 years had I been able to finish school when I first started. I was 3 months
Mhm.
away from graduation and I got promoted to sous chef at my job. So something had to give. Yes, I
Cool.
cried. I cried. I cried in the kitchen because my chef asked me for 3 months, when are you done with school? Every day he asked me. And I'm like, why do you ask me that? I need a sous chef, but I need one now.
wow, so you had to
Yeah.
choose between
Yeah.
finishing your degree and being a sous chef.
Yes. Yes. So he
Do you
came in the kitchen and I was bawling and he said, why are you crying? I said, because I was almost done. And he said, well, you can go back. I said, I can't. I have to start over. It's an accelerated program. So we literally take 4 or 5 classes at a time. So each massage therapy program is usually like 9 months to a year.
Wow.
Yes.
Oh,
wow,
so
do you
how did
regret it? Sorry.
okay, no, no, go ahead. Do you regret
Mm.
it?
Oh, no. Do I regret it? I don't because my other passion is food. I've been
Okay.
cooking since I was like 8. I was in the restaurant industry for 25 years. And it happened the way I guess it was supposed to happen. I moved to Florida. I didn't think I was going to go back for massage therapy. And one day I was just like, you know what? I wanted to do this. I'm going to do it. And
Mhm.
so I went on ahead and finished, and I've been in it since.
Wow.
Okay, can I tell you something really dumb before we move on
What?
to actually
Nothing
serious
is
stuff?
ever dumb.
So I had this visual, and people, only few people really relate to this. In the Real Housewives of Orange County, they had where they went for a sound bath, and
Oh.
there was a gong on one person's head, and somebody rung it,
I think
and
that's extreme.
yeah, that's not what it's
It's
supposed to
very
be.
extreme.
Yeah, but
So,
maybe some
and I
people need that kind of
But no,
extremeness.
because the vibe you can't certain frequencies, and then because of how they resonate, you should not be that close to the head anyway.
Yeah, it was a
Oh.
Now,
whole drama. It was a whole
yes.
fight. Yes, that
So
was not appropriate.
I've
I get
seen
that
I've
visual.
seen videos of sound baths where there's like, and you can place the bowls around the body. I use tuning forks. I use crystal sound bowls, Tibetan singing bowls. I use a crystal pyramid. I use koshi chimes. There's
Wow.
so many different instruments. I still want like 3 more. I don't have my gong yet, but because I want the really big one and I don't have space for that one. And it's really
Okay,
expensive.
let's
Wow, that's
back
not
up
Um,
even
from
I was gonna say, we weren't even gonna talk about sound bathing, so you automatically have to come back when you get
yes,
settled,
yes.
yes.
and because I wanna really ask questions about this.
It's
But
it's
Oh,
really
yes.
it's really therapeutic and it's a wonderful modality.
what if
Um,
you're partially deaf? Sorry.
hmm?
What if you're partially deaf? Does it still help you?
So it does have, just like anything else, you do have contraindications. So you have to be careful with hearing impaired. Anybody that has metal plates in their body, anything like
Oh,
that, anything that picks up vibration, because we are energetic beings. So any metals or whatever that can be affected by vibrations, you have to be aware of that. So yes, just like any other modality, you do need clearance from your physician to know that it's okay.
okay.
Anybody that's sensitive to loud noise or different frequencies, high pitch frequencies, low pitch frequencies, sound sensitivity is a very big thing as well. So you do have to be aware of all of that.
Wow. I mean,
Yeah.
that's amazing.
Yeah.
All
I
right.
want to go backwards a
Yeah,
little
go
bit.
backwards.
You
Sorry.
said you've been interested in a holistic lifestyle for a long time. Tell me a little bit about what that was like and what that means.
I'm not big on going to doctors. And when I would, I suffered from, so I suffer from major depression, anxiety, with PTSD. Some
Okay.
of it is passed down, my mom with my dad, and a lot of it is life experiences. But I realized in high school, like there was a time I would get sick. I've missed so many days in high school where insomnia is still my best friend. But I also noticed that I don't need a whole lot of sleep. If I can get 5 or 6 solid hours of sleep, my body's like ready to go for days, which is
Mhm.
still not good. So I don't sleep well. Um, but in high school, I read an article. I remember just being young and how stress affects, and stress is the main issue and cause of most illnesses and diseases in the body because it throws off your homeostasis. You are unbalanced. Anytime you introduce anything that's not good for you, as far as the foods we eat in this country, a lot of stuff is banned in other countries that we shouldn't even consume. Like if you really look up the ingredients in the foods that we eat, when you can drink something that can take away corrosion or erosion on a battery, or if a Dorito can start a fire, like what are we putting in our body?
Right.
Mhm.
And I think the most interesting thing with food that I saw most recently was there was a meme that was like all of the animals that we eat consume protein, don't eat meat. We eat animals who are herbivores that don't, we do that
Oh, I
to
see what you're
get
saying. Yeah.
protein. Yes, they don't eat meat. Why do we feel as humans we need to eat meat to get what we need? We don't.
Are you a vegetarian?
I'm going back to not eating meat. I'm very,
Okay.
like, I feel I have so much inflammation in my body from eating. I've been eating terribly over the last year or whatever. And I love food. So I'm never going to be a strict vegan or vegetarian. Meat I can do without, but I love seafood. I
Mhm.
love different grains and vegetables. I could be a vegetarian and be happy because I eat a variety. Most people are like, oh, I'm a vegetarian. All they eat is potatoes or broccoli or salad,
Yeah.
but nobody eats farro or quinoa or the different beans and stuff like that. So
Mhm.
I diet plays a big part in the healing of the body. The mind gut connection is a really big thing that is just now being integrated into our medical society. Uh, and people just don't understand that the body is made to heal itself. It is made to heal itself. Each part and each major organ in your body has a different timeline on as it heals itself. If we put in it what it needs, we don't have to do much work at all.
So when you were in high school and you read this article, because I just think of me in high school and I would have been like and thrown it off to the side. Like, you know what I mean? It must have resonated with you that stress really plays a factor in your health.
It did because of my home life. Like we forget in school, like that's where we're at most of the day. Well,
Mhm.
my school for me was a refuge for me. And
Mm.
my home life wasn't terrible, but it was very stressful. Um, and so it was an escape. So notice, and then I read a lot. I still read a lot. Like my daughter, I went to nursing school, but I had to stop because I didn't have the support system I needed. So my daughter still today, and people in my family still ask me questions. My daughter's like, "But mom, you're a nurse." No, I'm not. I just read a lot. I am not. I just read a lot. So I was the same way when I was younger. And I just started putting the pieces together of the urinary tract infections, the migraines, the just, the sleeplessness and everything is all because of stress. And so
Mhm.
as I got older, I was still in situations that were very stressful, abusive situations or whatever. But now focusing on that, like just deleting the stresses in your life. I don't care who it's from, what it's from, or whatever. When you remove yourself from stressful situations, it's just the body works better. The mind is at ease. When your mind is at ease, your body is at ease. And it's just that
It
connection. So when you're stressed out, you'll get nausea or your stomach's upset or whatever. And it's just that connection of the mind body. And a
Mhm.
lot of people don't understand it or don't realize that that's really what's going on. It's not necessarily something you ate bad or you just don't feel well. No, there's a reason that you're not feeling well. And the
Yeah.
body
has
holds, go ahead.
no, I was gonna ask you, has, have the things that you've learned in terms of healing the body and taking care of yourself, has that helped when you've been dealing with, it sounds like a lot of stress at most of your adult life?
Most of
Right.
my yeah. And it does help. So I don't take any medications anymore.
Oh,
Um,
okay.
and mainly because again, Western society, it covers up everything. You take a pill for something, but then because of what it causes, you have to take another pill for that, and you have to take it, and
Yeah.
it just piles up and piles up and piles up. Well, the source of the problem is never addressed.
Right.
We talk about shadow work with energy work and massage and just self-healing. We talk about shadow work, and a lot of people look and think about it as like this whole negative thing. No, shadow work is just self-reflection, and it
What I
takes.
don't know what I'm not familiar with what is shadow
So
work?
shadow work is simply self-reflection. It's
Okay.
looking beyond what you see in the is looking at yourself in the mirror, but really seeing who you are, really going back and peeling back the layers like you're an onion. Like you have to figure out what seeds were planted in you as a child, what causes you to attract the negative things, or what causes you to feel a certain way about
Mhm.
yourself. Because as children, we come into this world innocent. We don't know anything until those seeds are planted about our self-image, about our
Mm.
personalities, our characters. Everything is poured into us as who we're supposed to be.
Mm.
And sometimes it's all positive, sometimes it's all negative, sometimes it's a combination of both. But when it affects your life, you have to sit with yourself and really take the time. It's like, when was this one thing said to me? By who? And how did it affect me? And what can I do about it now? So you just really have to peel back the layers for self healing. You can't just look at the surface and say, oh, I have a stomach ache constantly, or I'm always getting headaches, but why? Or I don't like how I look, but why? At some point, somebody has said something to you or done something to you to make you feel bad about yourself. You don't just wake
Mhm.
up and feel bad about yourself.
Oh. So there's like
So
so you're saying like shadow work helps you uncover something that
the,
maybe somebody
the
said to you when
sources,
you were
yes,
7 years old and you've
yes,
never forgotten it.
because the body and cells hold memory. And just like with trauma, emotional trauma, physical trauma, all of that, the body holds memory just like for drug addictions or different addictions, food addictions. When you introduce something to the body and then you stop it, if it's something that you keep doing over and over and over again, because it has memory and because cells have memory, once you reintroduce it, it's like a light bulb goes on. Like, oh, I remember how this made me feel. And so
Oh.
that's why it's easy to fall back into bad habits or things like that. But the same could be for good habits too. So if you have this healthy lifestyle, or if you notice either if you start eating healthy or you start exercising on a regular basis, the moment you stop, you feel like crap.
Mhm.
Mhm.
And you're like, wow, I feel terrible, because you've created a memory, you've created a sense of well-being in your body. So when you stop that, your body's like, wait, where'd it go?
Right.
The
Mhm.
same thing with a drug like sugar. The body reacts to sugar the same way as it does to cocaine.
Mhm.
And so it's like that feel good feeling. Oh, okay. So then when you stop and you reintroduce it, it's like, hey, it's
Yeah.
back. Right. And
Yeah,
so
it's
then
how
you
to
go on a binge
say. Yeah,
again, eating
right.
sweets, right? Chocolate cake, right? I got it. So it's the same. It's the same. It goes both in a negative way or a positive way. And it's just about what you want to do with your well-being and how well you wish to be. With massage, I've realized that helping people feel better helps me feel better.
How did you
Um,
first get involved in doing massage?
I don't even know when the seed was planted or when I first just with reading and everything was like, oh, I think I'd like to do that. And so it's not something, yeah, you have to go to school to learn it, but I think having a healing and nurturing nature or personality, that's always been me. I've always been the person, the caring person, the nurturing person. I've always taken care of everybody around me. So it
Mhm.
was something that came natural for me. Um, and then when you hone in and you have certain gifts or healing gifts or spiritual gifts, and you're able to hone in on all of that because it's everybody, I think everybody has something innate that they're born to do. And it's that
Mhm.
one thing that you know you'll do whether you make a lot of money from it or not. For that,
Right.
for me, it's massage and cooking. I can speak about healing stuff and food for hours because those are my passions and my art.
Oh, it's
So
very
anything,
obvious that it's your passion. It's
Yeah,
but
very.
all
in
of
a
the
good way.
creative
It's a
things.
good thing. Yeah.
Thank you.
It's
Um,
envious, actually. It's very
no,
envious. Like, I'm sitting here, like, thinking to myself, like, "Do I have anything that I'm that" like, you can tell in your face that you're passionate about it. Do you know
thank
what I mean,
you.
Kamna?
Yeah, I'd
Yeah.
agree.
I love what I do. I really do. And I'm so sad to leave. I have a clientele here that I've had a couple clients cry because I'm leaving. One lady called me last night. She called the salon that I work at. She called the spa that I work at on the phone to talk to me because she couldn't get in for her massage today and she wanted to tell me bye. So
Aw.
I love the connection that I have, and I have a different connection with each of my regular clients. But it's just I don't believe you can go into this field with a robotic mindset
Oh,
and be scripted because we're all human and we all interact differently with each other. And
So
so I
I
stay
want to,
authentic.
sorry,
Go ahead.
I wanted to ask you a really specific question. It's very,
Yeah.
it's about me, but um, I was having a massage with this lady and she disappeared. I tried to find her because she was so good. But she would touch certain spots like behind my ear or something, and I would
Mhm.
realize, oh, I didn't know I had pain there.
Yeah.
How, and I asked her, I said, how did you realize? Like she would focus on an area and I would say, how did you notice? She said, that's what we're trained to do. Can you talk about that at all?
So that goes into the energy modalities, and everybody is not able to do that. Some people just go into
Oh,
a massage. There are massage therapists who are called, for lack of better terms, one trick ponies, where they only do one pressure or they only do certain modalities. When you are in tune with your healing gifts or whatever, and energetically, you automatically kind of know. I've gotten the same thing. How did you know to go to that spot? Or you're right on that spot, or how did you know to do that? It's it's almost like it's a feeling. So you kind of just intuitively know to go to certain areas, or just by getting to know your client, even if it's a
wow.
first time, and you kind of know what to do automatically. I sometimes still don't know how I know
okay.
where to go. And a lot of times I can do something, but I can't, like, I don't have the muscles memorized. I know the main muscle groups or whatever, but I know how something is supposed to move intuitively. So I automatically know what to do or what to address in order to improve that area. And it's just
So
something that just comes to you.
if one of us came to you and said, I have really bad pain in my back, do you have like do you know that means maybe the feet are hurting or that like do you work on other
Mhm.
things
Yeah.
or
So one of the main things, and I had a client, and I have to, and it's sad because when you work for corporations or different spas in the industry outside of your private practice, the psoas muscle is your major hip flexor, and it's a large muscle. A lot of people struggle with back pain, but it's not necessarily your back that's causing the
Mhm.
pain. Like you said, it could be a foot or whatever. So the psoas muscle connects to the backside or the front side of your vert. Like if you were, I'm looking through you, or if you're looking through me, facing me, you're looking through my body to my spine. The psoas connects there at the vertebrae, but then it wraps around and comes across to the groin area. So it crosses the hip. When it's tight, it's pulling on your back.
Okay.
Um, And that's what usually is the cause of low back pain. And another thing that causes pain, so everybody says, oh, massage increases range of motion. That's true. Your muscles allow you to move. But one of my main passions with massage is myofascial release. And fascia, a lot of people don't even know what fascia is. If you eat chicken, it's that thin film between the skin and the flesh.
Okay.
Right? Have you
Yeah,
ever
and I
seen a
eat it.
chicken thigh, that clear film?
Yeah.
So yeah, so that's the best analogy that I could use because it's a visual that everybody can relate to. In your body though, we call it your internal body stocking because it literally holds everything
Okay,
together
that
and in
makes
place.
sense to me. The
Okay.
chicken thing didn't make sense to me, but that makes sense to me.
So just like how muscle fibers are separate, muscles, organs, everything is separate in your body, right?
Yeah.
Well, imagine if nothing was holding it in place, everything would kind of just flop other than your skin. But if nothing was holding it under your skin in place, everything would sag, right? So your fascia is one big piece of connective tissue. It does not separate in any way. So it goes in many different directions. When you
Okay.
think about a muscle being encapsulated by fascia, if the fascia is bound from lack of movement or dehydration or anything, you can work that muscle and you can exercise, but then you're like, wow, why do I still feel tight? Why is it not stretching? Or I'm stretching. Well, if the fascia is bound and not loosened, the muscle cannot relax and expand.
Oh, wow.
So, yes, your muscles cause the body to move, but fascia increases your range of motion because if your fascia is tight and because it's all connected, I can be tight here, have little range of motion in my shoulder, but it may be because my fascia is tight in my pecs or up under my arm or whatever. So going
Can you
back to the
feel that?
whole,
Can you feel someone's fascia being tight, like bound up?
yes. So you could probably do this on yourself right now. So if you take your fingers and press into your arm or your forearm, and it's a dry modality, myofascial release is done without any oil or lotion. So if you're
Okay.
trying to push down and through, if you notice where it stops, like if your hand's not moving, don't force it. But if you don't feel a gentle glide and your hand gliding along that muscle tissue, it's stuck.
Look at us. Kamna and I are both doing it right now for the
We're like trying to figure this
I'm
out.
doing it to myself.
I
So
don't think I completely understand, but I'm not
so
trained
it's
like you.
okay. So we call it, so the friction caused by pressure is what we say melts the fascia or loosens it up.
Okay.
When I'm massaging, before I put lotion or anything on there, if I'm massaging and the pressure from my hand and I'm gliding on the skin, but then all of a sudden it stops, I know that that's an area of restriction. And so I'm pushing through. You ever see athletes or trainers using scrapers, those metal things, tools, and they're scraping
Mm-hmm.
Yeah.
across muscle tissue?
Oh,
They're breaking up fascia because if the fascia is tight, they're keeping it loose so that the range of motion flexibility can be maintained with that athlete.
is that what those rollers do for your face?
Those are more for lymphatic things. So
Oh,
yeah,
okay.
but yeah, the ones that are like scrapers, yes, you can do
Yeah.
that. But it's just light. But most of those tools are for lymphatic drainage because they work with moving waste through the body and for it to not collect anywhere. So you
Okay. A little
just
different.
deadly. So yes. So there's so many, like massage is such a vast, and I'm grateful for it. And it's always something new added because the body is a magnificent machine. So there
Mm-hmm.
isn't just one thing that you can do to heal the body or for your well-being. But with massage, there are so many modalities that you can put together outside of the therapeutic touch. Not to negate the benefits of therapeutic touch, because how many people passed away from COVID just for not having that human connection? We are meant to be connected. We are made to touch. We are made to hug. That's what we're here for, to be connected. So you need that, just that touch. And that can be done with clothing, without clothing. And that's going to go into your yo massage questions that you have. Like, what is yo massage?
Okay, but wait, I have
And I
another
saw your
question.
face light up. I was like, nobody knows.
Okay, so
Um,
let me back up. So you could feel the fascia and then you could
yeah,
help smooth that out. And
yes,
that is really what helps the range of motion, correct?
yes.
Okay. But you mentioned the psoas muscle as being a big contributing factor to your back
The
pain.
back pain.
But is that something you're technically not supposed to touch on
I'm
someone?
trained in it, but yes, when you go into, like, I work at Hand and Stone. So Hand and Stone, Massage MBs, Elements, all of these places, we can't, there's so many things that the body needs addressing that we can't do. It's
Because
in my scope of practice.
it's in a
It's in my scope of practice. It's just not procedure for, like, in my private practice, I can address every muscle attachment. I can address whatever I want.
but if you
With
go to a
consent.
salon, they're not gonna touch your psoas muscle.
No, because you have, in order to address it, you go through your abdomen. And it's kind of, it's an invasive, yeah, you have to go,
Does
I
it
would have
hurt?
you, when it's uncomfortable. To release your psoas muscle is not comfortable at all.
I wanna know more about that.
But it's a main cause of back issues. Your rectus abdominis, which is your main stomach muscle, which are your six pack. That
Okay.
muscle causes low back pain when it's tight. But
Leah, do we
again,
have a
it's
six-pack?
Never.
I have a 2 pack.
I don't even have a I don't
I
know what
might
I
get up to a 4. I don't think I'll ever have a 6 pack.
That's
so
I
really
might get
interesting that
to
it
a
goes through
4.
your abdomen.
So yes, because
Abdomen.
because
Can't say
remember
the
I
word.
said it crosses over your hip bone. So to address it, you would take a deep breath, and you would, upon exhale, I would take my fingers to find the muscle belly. And so it's an evasive procedure, but
okay, so wait, this is dumb, and this is such a
no, it's
childish
not.
question. Do you like, I feel like if you push on my stomach, I'm gonna release gas.
Possibly.
Okay. Alright, and that's okay. Nobody
Yes.
should feel embarrassed if
You have no idea how many people have passed gas
Oh,
okay.
really?
on a
I feel
massage
good
table.
knowing that.
It's unfortunate for me because it's trapped underneath the blanket, so when I move it, I get hit in my face.
Oh, no.
But
That's
it's
that's not nice, but yes,
okay, well, that makes me feel better that I wouldn't be the first one that ever released gas if you
you
massaged
would
me.
not
Okay,
the first or the last.
okay.
Trust me.
So
Um,
before we talk about the yo massage, I have another question. I
yes.
remember this same massage therapist when before I had my hysterectomy, she gave
Mhm.
me abdomen, I cannot say the word, abdominal
Abdomen massage,
massage.
abdominal massage,
Okay.
yes.
And she said it's before the hysterectomy because it helps with healing afterwards. Can you explain any of that?
So energetically speaking, yes. It's something that's been done for centuries. There is something I still want to do because I left that out. I am also a doula. I have my doula certification. I focus
Oh
on
my
postpartum.
gosh.
Sorry.
Wow. Wow.
I'm done pretty much. But with the abdomen, it goes like to the mind gut connection. And
Okay.
through the abdomen and through an abdominal massage, you can address so many emotional issues. So going with the hysterectomy, that's more of an emotional thing and releasing of the trauma because I also have had a complete hysterectomy, no ovaries or anything. And as
Okay.
women, we know that we're here to bear children, even if we don't want them, even if we don't have them, even if we've had them. When those parts are removed, you do have a sense of emptiness, of disconnect from your femininity. And
Okay.
so going for the healing of the hysterectomy, you're allowing things to move back into place with the abdominal massage on their own instead of just you're helping it. Because if you don't address it and kind of gently put things back where they go from the massage, a lot of discomfort can still be had. A lot of, there's a void there. But most of that with the abdominal massage is for emotional healing.
Oh.
When I asked her, she indicated that it stimulates like blood flow to the area and
Yes,
then cells regenerate. And
yes,
is that make sense or?
yes, because that's a main benefit of massage, period.
Okay.
It
Okay.
increases blood flow and all of that. So yeah.
Wow. So would you recommend somebody get an abdominal massage maybe before you got it before, but like even after to help with the emotional healing part of it?
Yes. And
Oh,
there's a thing called closing of the bones. And it's very, very common in Mayan cultures and indigenous cultures where as soon as a woman has a baby, like hours after, she's tied in these cloths
Mhm.
and the hips are rocked back into place. Because if you've noticed in our society, when you're pregnant, your goes back to the muscle memory. How long do we walk? It's like the same way from carrying that weight. We hold that posture for a long, long time
Mhm.
because our bodies have been in that posture for months of our hips opening up. Well, the
Right.
bones are made to close back up. But if nobody's doing that for you, you don't know how to do it on your own. Nobody teaches us
Right.
that in our cultures, in our society. So it's a well-being thing. You're literally closing the bones and you're rocking and you're healing. And say if you had a traumatic childbirth, all that emotional trauma is tied up in that area or whatever. So it's a healing both physically and emotionally. So yes, before, after, it's
So
beneficial for all of that.
is that what I'm again just thinking like, is that why some women have hip pains later on in life? Because we've never
Yes,
closed our bones? Like
yes,
I
because you're
guarantee my
not
bones
you're
are the same from when I
our
had my
pelvises
kids.
opened up to create room, but then we go back to the same things we were doing without taking the time to heal. Our bodies heal at rest, but our society is not made for us to rest.
Right,
Look at how fast we're expected to go back to work after having a baby,
right,
after having surgery, after you cannot, we don't have time to heal.
right.
And so all of our pains are from that. We don't have time to heal.
Wow. It makes so much sense to me.
It does.
Just
What
now making like 4-day work weeks. How many countries have 4-day work weeks? I only work 4 days a week. Why? Because I realized that I function better for myself and for whoever I'm working for, working only 4 days a week.
Mhm.
Because I need that day where I can do my chores. I need that day where I can spend time with my family. And I need a day to where if I don't want to do anything at all, I don't have to.
Right.
Can you call my boss and tell her that I only can do 4 days?
I'll be glad to. But and I've gotten so in tune with just my well-being. I don't have a problem because the worst thing that can happen, and that's to say, don't go quit your job tomorrow because it's
Mm,
just how I think. Um, I even tell my daughter the worst thing that can happen is you have to find another job
mm,
because we have to take care. We have to get into the mindset of you being more important. And I'm speaking to myself as I say this just because of stuff that I go through on a daily basis. Remind myself, if you drop dead at your job or if you fall ill at your job is going to keep going.
right.
Mhm.
Once we're gone, we're gone.
Mhm,
And so whether they realize your worth, your or whatever, or your importance, or whatever, it doesn't matter what anybody else thinks. You have to know what your value is to yourself and that job. Yeah, that job's going to keep going without me, but I am an asset. So for me to function at my best level, this is what I need. If they
Right.
can't give me what I need, then that means I need to go somewhere or do something that can,
yeah,
because we're not made to sit here in this world in this lifetime to just work until we die. And that's
mm,
how our society is made up.
mhm.
What do you think has been the biggest transformation you've seen with a massage client?
Oh, good question.
Uh, Range of motion, emotional healing. I have clients that come in there and we laugh the whole time I'm giving a massage. We're talking and laughing because sometimes that's just an outlet. And some people
Mhm.
just need that moment to just be able to just be without wearing a mask, without being pretentious, without being what society thinks they need to be. They just need that space, that safe space to just be. And I have affected so many of my clients that way. And for me too, like I had an incident on my break that brought me to tears. And she's my client on the table, but she's one of my regulars. She allowed me space to just be in that moment. And it's a beautiful exchange when you can have that with people to where it didn't matter that she was paying for that session. She was like, you know what? I'm okay. Go ahead. And I was like, I'm fine. And she allowed me to wipe my face and she talked to me and we were giving advice. And, it's just, that's the biggest transformation when you can go into a space and just have whatever kind of release you need, whether it's
Mhm.
physical, emotional, or whatever. And for you to be able to walk out with a smile and just feel like the weight of the world, even if it's in that moment, that hour, the weight of the world has been lifted. And so, yeah, sometimes when you walk out that door, I've seen it where like they're on cloud nine coming out of the room, but then as soon as they hit the lobby, it's back to because they got to face the world now.
It's really interesting to me the way you're talking about massage therapists as like I'm a big proponent of mental health, like seeing a
Mhm.
psychiatrist or talking about your
Yeah,
mental health problems. But I'm also big on saying like you can walk in a room and hate your therapist. You need to go
yeah,
find somebody else and find
yeah,
3 or 4 people. And I think the same thing can be said for what you're saying is like if I go get a massage and I walk out and I'm just like, yeah, it was okay. Like you're describing a totally different environment than what I've ever assumed was a getting a massage. Do you know what I mean, do you know what I'm trying to say?
yes. And that's it's how most because it's a lack of education, it's a lack of empathy. You have people in this field that just do it for the money. The money
Right,
is great. But if you're not in tune with yourself and you're just doing that, then you're not addressing, you're just flipping body. It's a body count for you. It's not a
right,
body count for me. I actually take the time with my clients and we actually spend quality time in that room. Sometimes it's in complete silence, sometimes it's a laugh fest, but they're still getting the therapeutic touch, they're getting the mental stimulation they need, they're getting that time to just be
right.
quiet because they have kids at home and they don't have the time to just lay down. When I'm on that table, I get very few massages, but that goes for the beautician that doesn't get her hair done or the nail tech whose nails look a hot mess. It's the same for us too. Like I
Yeah,
know though I need to do it more um, because it'll only enhance my skills that much more because I'm releasing things that I hold on to. But sometimes when I'm on that table, just to be still for that moment, it means so much.
so it's like a totally yeah, I it's not as clinical as I think people think of it as.
And it can be so that's a different sector of it where it is clinical, where it's just, repairing the body. But
Yeah,
even with repairing the body, because of the mental trauma from it, whether it's from an injury or surgery, even when you're repairing the body, you're still easing the mind because it's still, even though there's a different sector of it just being clinical, it's still that connects.
mhm,
So there's always going to be the mind body connect. So that's why you can have people that get a massage and be like, oh, it was just okay because they're
yeah,
missing the connect.
yeah,
So yeah.
Is it okay? So I was imagining myself wanting to get a massage, and I have a hang up of somebody seeing me and possibly judging my physical body. How you're the person on the other side? How does that like? You're just doing your job, but does it like the hang up that I have? Does that impact? Oh, you know what I'm trying to ask,
Yes.
yeah,
right?
You know what you're trying to say, which is the biggest taboo in massage therapy. Um, of course, when you're working with the body, the more I have access to is for that, the touch thing, the better.
mhm,
Mhm.
However, that's your session. And so if you say, I don't want to take any of my clothes off, can you massage me? Yes. Will I be limited to what I can do? Yes. But there's still
Mhm.
other ways I can still make you comfortable. I can do compression. I can do holds. I can just lay my hands on you but that's where that whole alignment comes with me and knowing and being intuitive to what my client needs. Because the average therapist will be like, oh, they're not taking anything off. I can't give them a good massage. I can't do my job because they don't want to take their clothes off. And so
Mhm.
they're not going to give you what you need because
Mhm.
of their mindset. No,
But
I'm
so if
still
I'm a
able.
client, I don't need to worry about that. Whatever my comfort level is a
What
good
and that's the
massage
verbiage that
therapist.
is used down to your comfort level.
Okay.
So I have clients that are completely bare because with draping, you're only uncovering the areas that are being worked on anyway.
Right.
right,
Um, glutes are worked through the sheets at establishments. I worked in Florida, or some places, some states it's mandatory, some states it's not. The states that aren't that where it's not mandatory, I'm very comfortable working on the naked body where the genitals are covered or whatever, because there's still some integrity that has to be had or whatever.
Mhm.
And moving to Tennessee, taking the class, the instructor of the law class, she put it in ways nobody's ever said it. It's the truth and we know it, but she's like, you have to think about the line and how we have to be so strict sometimes because we are the only medical profession that allows a person to go into a dim lit room, remove their clothing, and we're rubbing on their body.
That's a
Yes,
very
you
When
put
you
it that
think
way.
about it that way, right, right? How far left can that go when you
Yeah.
really put it in that perspective? And
Mhm.
so you have these guidelines in these places, and I understand it because some people do go left with it, which causes
Right.
a problem for those of us who really want to help people.
Right.
And so the hangups, and I can still go into the Yo Massage. So Yo Massage was created by two ladies,
How do you spell that?
Yo Massage, one word,
Y-O?
YOMAS, yes, and massage.
Okay.
I've been certified going on, it's like 3.5 years now. I'm just now putting it into practice with my own practice. People still have no idea what it is, and it's crazy to me because it's very well known. They're based out of Oregon, so the West Coast knows about it a lot.
Okay.
Nobody in Cleveland is doing it. People in Columbus, outside of Cleveland, a couple people. Even when I was in Chicago, a couple of people outside of the but nobody in these major cities knows what it is, and it's perfect for people who have the hang up of removing their clothes. So you focus. So you open up with a meditation. It's a mindfulness exercise, but the focus is restorative stretching and massage and therapeutic touch. So it's a combination of the three. So it's fully clothed. You can do it at one-on-one sessions or in small groups. I can take up to 8 people. And so I instruct you and move you into these positions because you use the yoga props, you use the props and the mat and your blanket and your bolster. So I instruct you on how to get in these poses while you're in that restorative poses, because each pose is made to send your body into the parasympathetic nervous system, your rest and relaxation state. While
Okay.
you're in that state, I go around and I massage gently the parts of the body that are exposed, whether it's your arms, your thighs, your back, your low back, your shoulders, your neck, your feet. They also have the energetic Yo Massage, which is what I focus on in my practice, where I can do Reiki in place of the therapeutic touch, in place of the massage. So, or I can combine the two. So that's perfect. It's a perfect modality for people who, whether it's religious reasons or whether it's how self-image reasons, that don't want to remove their clothes to get a relaxing experience
So
or
it's more
massage.
like I would be doing, for lack of better words, like an actual yoga pose, and you would come over and
Yes,
massage that
yes,
area that needs to be, like, melted more. Like, if I'm in a downward
yes.
dog and this isn't going flat, like, you would rub that down to get it where it's supposed to go.
Not no, because they're not even really yoga, like how it's the yoga poses, but how some of them are stretches. So you would be in that pose for like that stretch for like 10 minutes. And that's what allows the body to just let go because you're doing deep breathing while you're in that pose. So say it's a side lying position. I'm going around and I'm massaging the hip or the low back or your thigh, the your IT band or whatever. So yes. Or if you're sitting up in a lotus pose, I'm massaging your shoulders and your upper back
Okay.
or your lower back. Yeah.
So,
Yeah.
I think we have a bunch of questions we'd like to throw at you, but I'd like to save that for our bonus episode. So,
Okay.
if you could stay on, but thank you so much for joining.